It's really been something to see the coronavirus story change in just the past few days, really, in the past week, to see how the virus is changing in terms of the severity of it, the cases, the countries that are affected by it, and just what those countries are doing, the lengths that they are going to prevent this spread, and, well, really just to minimize the damage from what certainly seems to be a global pandemic. One of the most interesting facets of all of this is that Canada seemed to get it almost first before so many of these other countries. January 25th, that was the day when it was confirmed that the first case was identified in Canada. And there's a lot of concern and alarm and panic. And Canada has a more sizable population from the Chinese community, Chinese Canadians, people who are getting off planes from China, from Wuhan even. So there was worry that we would get it perhaps more than some other countries. And we certainly got it sooner. But here we are with really not that many cases. People who seem to only have it mildly, for the most part, are resting at home. They're doing okay after a month of us actually grappling with our first case. But then we look to countries like Italy, Iran, South Korea. They don't seem to have had their first cases all that long. Iran certainly not, Italy certainly not, and yet they have hundreds of cases now, and they have reported deaths, a number of reported deaths, particularly in Iran. Incredibly troubling to see it move in this direction, to see concerns increase, and of course the stock market dropping quite a number of percent just on the past couple market days, Thursday and Friday, as people see the ripple effects of this, the cascading effects, and wonder, what is it all going to mean? What will it mean for the economy? What will it mean for our communities? And that community part is where it gets interesting, where a lot of us here in Canada are wondering, what's going to happen here? What should happen here? What should we encourage to have happen? What should we permit? Because they're certainly doing interesting measures in other countries. In Italy, they're saying no more church masses. They're also saying no more Premier League soccer in the northeast of Italy. That's really something. I mean, soccer and church, that's like, all of Italian pastime right there in one. They're saying no to that stuff. In Japan, no school. School has been canceled for a while. Switzerland does not really have it all that bad. They just have more or less around the same number of cases as Canada. They don't have a flare-up like Italy and Iran. They have banned gatherings of 1,000 people or more. The Center for Disease Control in the United States says, yes, social distancing might soon be coming to the United States, or at least to some of the affected regions. California currently dealing with some cases there. What's going to happen in Canada? What should happen in Canada? Air Canada recently expanded that flight ban to China well into April. Should we be doing the same for Iran and Italy, particularly Iran, since Canada's latest cases do come from people who had been to Iran? That's a good question there. Well, the Air Canada decision, that was made by them. It was not forced upon them by the government. It would be great to see the government show more leadership in this. Because is it going to come to Canada? Well, it certainly seems like it is. But the question is, how much more distance can we give ourselves? How much more can we spread it out? How much more lead time can we give ourselves? Medical researchers in various different labs and companies and so forth are working to put together vaccines, and the longer we go without being heavily hit by it, the more time we have, the more time we're buying to get us closer to when those vaccines are ready. Many good reasons for us to take precautions, and never in our lives, or really in the lifetimes of even our parents, and for those who have grandparents still alive, probably in their lifetimes, they've not really experienced anything like this unless they lived through the Second World War. It's quite incredible to see something like this unfold, where we would basically face broader community lockdowns, where schools would shut, you'd be working from home. All of these issues that seem like they're straight out of one of those outbreak movies or some sort of wild novel about a dystopian future, but that's the conversation we're having right now. That's the reality we are presented with. So be prepared, and nobody wants the government to tell them what to do in this aspect. I'm as libertarian as it gets when, hey, government, stay out of my life. But at a certain point on these public health issues, we're probably going to have to rally together and agree to have some sort of disruption in our lives.